Students, ABG is a blood test that helps us assess three important things. First is the oxygenation. Is patient getting enough oxygen? Then next is the ventilation. Are the lungs removing carbon dioxide properly? Third is acid-base balance. Is body acidic or alkaline? So we perform ABG in patients with breathlessness, respiratory failure, diabetic ketoacidosis, in patients of poisoning, severe vomiting or diarrhea, then in patients of ICU and emergency patients, in patients of sepsis and shock. So starting with the video, first we'll study about what is the ABG, then next will be the normal values, then next is approach to ABG interpretation, then next is the compensation part, and last is the clinical question in the MCQ. So starting with what is ABG. So ABG is arterial blood gas analysis. So normal values for pH is 7.35 to 7.45. For carbon dioxide, remove the 7 and it is 35 to 45 for easy remembering of the values. Next is oxygen, that is 80 to 100 mm of mercury. Then bicarbonates 22 to 28 millimoles per liter. Base excess normal value is -2 to 2. Oxygen saturation normal value is 95 to 100%, and an ion gap is 8 to 12. So pH is a measurement of acidity or alkalinity of the body. It is inversely proportional to the number of hydrogen ions in the blood. The more H positive present, lower the pH will be. So likewise, fewer H positive present, the higher the pH will be. So pH can be acidic or alkaline. So acidic further divided into, it can be either metabolic acidosis or respiratory acidosis, and alkalosis can be metabolic alkalosis or respiratory alkalosis. So the pH of a solution is measured on a scale from 1 to 14. A liquid with pH of 7 such as water is neutral. So normal blood pH range is 7.35 to 7.45. Significant changes in the blood pH above 7.8 or below 6.8 will interfere with cellular functioning, and if uncorrected will lead to death. The only two ways an acidotic state can exist is from either too much partial carbon dioxide or too little bicarbonate. The only two ways an alkalotic state can exist is from either too little carbon dioxide or too much of bicarbonate. Then we have two buffers. One is the respiratory, or you can call lung buffer response, and second is the renal or metabolic buffer response. So starting with the respiratory buffer response, it's a normal byproduct of cellular metabolism is carbon dioxide. So carbon dioxide is carried in the blood to the lungs, where excess carbon dioxide combined with water to form carbonic acid. The blood pH will change according to the level of carbonic acid present. This triggers the lung to either increase or decrease the rate and depth of ventilation until the appropriate amount of carbon dioxide has been re-established. So activation of the lungs to compensate for an imbalance start to occur within 1 to 3 minutes. Next is the renal or metabolic buffer response. So in an effort to maintain pH of the blood within its normal range, the kidneys excrete or retain bicarbonates. As the blood pH decreases, the kidneys will compensate by retaining bicarbonates, and as the pH rises, the kidneys excrete bicarbonate through the urine. Although the kidney provide an excellent means of regulating acid-base balance, the system may take from hours to days to correct the imbalance. So when the respiratory and renal system are working together, they are able to keep the blood pH balanced by maintaining 1 part acid to 20 part base. So starting with the causes of acid-base balance. So first we'll start with metabolic acidosis. So first cause of metabolic acidosis is diabetic ketoacidosis. Main keto acids are ketoacetic acid and beta-hydroxybutyric acid. Starvation, ketosis, lactic acidosis, and renal failure contribute to endogenous acid load, while there are decreased excretion of hydrogen ions in the renal tubular acidosis, and there is gastrointestinal loss of bicarbonates in diarrhea, small bowel fistula, and there is urinary loss of bicarbonates in renal tubular acidosis. So one important thing is in the form of MCQs, there is Kussmaul's respiration in diabetic ketoacidosis, which is a cause for metabolic acidosis. So what is Kussmaul's respiration? It's a rapid deep breathing which is observed as compensatory hyperventilation to severe acidosis. Causes of metabolic alkalosis are persistent vomiting, Cushing syndrome, diuretic therapy. So in sustained vomiting, there is loss of hydrogen ions through vomiting. Then in case of diuretics, there is increased acid and chloride loss in the urine. So in case of Cushing syndrome, alkalosis occur due to increased hydrogen ion excretion in the urine, which occurs secondary to increased sodium reabsorption. Causes of respiratory acidosis are severe asthma, pneumonia, COPD, chest wall injury, cardiac arrest, and opioids drugs. So airway obstruction and pulmonary diseases causes respiratory acidosis. In this case, there is depression of respiratory center, retention of carbon dioxide due to impaired alveolar ventilation, resulting in rise in carbon dioxide. Next are the causes for respiratory alkalosis. So first is hypoxia occurring at high altitudes. Then there is hyperventilation resulting from hysteria and anxiety. Then there is overdose of artificial ventilation. Other causes septicemia. We will start with ABG interpretation. First we'll start with components of the ABG. So first is the pH. So pH normal range is 7.35 to 7.45. So pH less than 7.35 means acidosis, and pH more than 7.45 means alkalosis. So second is partial carbon dioxide. So its normal value, remove the 7, normal value is 35 to 45. So partial carbon dioxide less than 35 means alkalosis, more than 45 means acidosis. Next is bicarbonate. So bicarbonate normal value is 22 to 28. So less than 22 is acidosis, more than 28 is alkalosis. So next is partial oxygen, that is normal value is 80 to 100 mm of the mercury. Then next is saturation, normal saturation is 95 to 100%. So base excesses -2 to +2 millimoles per liter. Next is how to interpret ABG. So we will do in a stepwise manner. So in the first step, just see the pH, carbon dioxide, bicarbonates. Okay? For each component, label it as normal, acidic or alkaline. So in first case, as we say, pH is 7.30, so it is less than normal, that means it is acidic. Partial carbon dioxide, that is 55, that is more, it means acidic. Bicarbonates are in the normal range. So this is basically case of acidosis, right? So this we know that this is a case of acidosis. Now we have to look for whether lungs are involved or whether kidneys are involved. So as we can see, bicarbonates are normal, but partial carbon dioxide is more, that means it is acidic, that means lungs are involved. So we will look for whether it is respiratory or metabolic. So metabolic is ruled out because bicarbonates are normal, so respiratory system is involved. How other ways in the mnemonic form, how we can remember respiratory opposite, metabolic equal, right? So pH is decreased, carbon dioxide is increased, so this case is of respiratory acidosis. Now look for example number 1. So in this case, pH is 7.50, carbon dioxide is 42 and bicarbonates are 33. So as you can see, 7.50 means pH is alkaline, so carbon dioxide is within normal limits and bicarbonates are increased. So it means pH is increased, bicarbonates are increased. So both in the arrows are in the same direction. Respiratory opposite, metabolic equal. Metabolic equal means both arrows in the same direction. So that means pH is alkaline, cause is metabolic. So this case is of metabolic alkalosis. Now look for example 2. So in this case, pH is 7.30 means acidosis. Bicarbonates within normal range means lungs are normal. Next is bicarbonate. So bicarbonate value is less, that means kidneys are involved. So both in the same direction. pH in the downward direction, bicarbonates in the downward direction. So this is a case of metabolic acidosis. So treatment of this patient might include providing supplemental oxygen and administration of additional IV fluids. Next, looking into third example. So pH in this case is 7.50, that means it's alkaline. Carbon dioxide is 30, that means it's the reduced form, that is alkalosis. Bicarbonates is 24, that is normal. So arrows are in the opposite direction. So this patient is of respiratory alkalosis. So treatment of this patient might include correcting the underlying problem and slowing the respiratory rate down. Now notice, for the first time, both carbon dioxide and bicarbonates are abnormal, while pH is normal. So this indicates that there is some degree of compensation taking place. This will require slightly different approach to the blood gas analysis. So body tries to overcome either a respiratory or metabolic dysfunction in an attempt to return the pH into the normal range. Patient can be uncompensated, partially compensated or fully compensated. So how do you know when compensation is occurring? So when an acid-base disorder is either uncompensated or partially compensated, the pH remains outside the normal range. In fully compensated state, the pH has returned to within the normal range, although the other values may still be abnormal. So if both the carbon dioxide and bicarbonates are abnormal, but the pH is in the normal range, look at the pH again. So instead of using a normal range, 7.35 to 7.45, as we have been doing, we are going to use the single value, that is 7.40, as our only normal. So any pH less than 7.40 is now going to be considered acidosis. Any pH more than 7.40 is now going to be considered alkalosis. So look at our pH in this example. So pH is 7.38. That means it is acidosis. So carbon dioxide is 56, that means in the opposite direction. Then bicarbonates around 35. So this is acidosis patient. So applying the law of respiratory opposite, metabolic equal. So this example is of respiratory acidosis. So now we will look for whether this condition is partially or completely compensated. So if pH is between 7.35 to 7.45, so condition is fully compensated. If pH is outside the range of 7.35 to 7.45, so this condition is partially compensated. So in this case, pH is 7.38. So normal range is 7.35 to 7.45. That means it is fully compensated. So this is a case of compensated respiratory acidosis. So looking into the example, next is pH 7.45, carbon dioxide 48, bicarbonates 28. So carbon dioxide is in higher range, that means it is acidotic. So 7.45, otherwise the normal range, but we have to take 7.40, right? So it is more, right? pH in the upward direction, alkalosis, carbon dioxide in the downward direction. Then we have bicarbonates, which are 28. We will look for which system is involved. So kidneys are involved, as bicarbonates are on a higher side, pH is on the higher side, so it's metabolic equal. So this is basically a case of metabolic alkalosis. So whether it is compensated or not, so it's a normal, within normal range, pH 7.35 to 7.45. So that means this is a compensated metabolic alkalosis. So in the next example, pH is 7.33, means acidic. Carbon dioxide on the higher side, that means acidosis, means lungs are involved. So respiratory opposite. Bicarbonates 35 on a higher side, it's alkalosis, means there is some type of compensation going on. So that means this patient is of respiratory acidosis. So whether it's partial or whether it is fully compensated, so in this case it is outside the normal pH range, that is 7.35 to 7.45. So this means this is partially compensated respiratory acidosis. In next example, pH is 7.29, that means it's acidosis. Carbon dioxide is 30, that means alkalosis. Then we have bicarbonates that are 18, acidosis means kidneys are involved. So pH and bicarbonates both in the downward direction means metabolic equal. So this means it's a patient of metabolic acidosis, whether it's compensated or partially compensated. So in this case, pH is lower than normal. So that means this is a case of partially compensated metabolic acidosis. I hope you understood the various metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. So you also understood the compensation, partially uncompensated, compensated part. So moving towards the MCQ part. So first MCQ is a patient with prolonged episodes of nausea, vomiting, and diarrhea has an ABG order on admission. You might expect the result to show. So if nausea, vomiting, and diarrhea is the cause, patient can be of metabolic acidosis. Next is the interpretation part. So from the pH, carbon dioxide, and bicarbonates, we will interpret ABG. So in this case, pH is 7.33, carbon dioxide is 60, bicarbonate is 34. So answer is respiratory acidosis with partial compensation. So in next MCQ, pH is 7.21, carbon dioxide is 60, and bicarbonate is 24. So this is a patient of opposite direction. So this is a patient of respiratory acidosis without compensation, means pH is outside the normal range. Next, pH is 7.45, carbon dioxide 26, bicarbonates 16. So in the opposite direction, it's a case of respiratory alkalosis, and it is fully compensated because pH is in normal range, 7.45. So at the end, I will say never look at all ABG values together. Start with pH, then carbon dioxide, then bicarbonate, then compensation and oxygenation. If you follow these 5 steps every time, ABG interpretation becomes easy and logical. Thank you.